Welcome, everyone, to today's workshop on resetting your nervous system for chronic pain relief. Chronic pain is something that is affecting approximately 1 in 5 people at any time. And really, pain is something that eventually touches the lives of everybody. So we are really honored to be bringing you today's workshop. And we have a jam-packed session for you guys today. Over the next hour, you're going to be learning a lot of different practical and incredibly helpful techniques that you can apply to your life as soon as today, like beginning over the next hour. We have 2 different practitioners who have distinct areas of expertise that we're going to be learning from today. These 2 different areas of knowledge complement each other very well for what we're talking about today. I am going to pass it over to our hosts to introduce themselves, and then we will get started. Why don't we start with you, Kasey?
Thank you, Shelby. It's so nice to be here with you all. I am an occupational therapist by training. Prior to that, I went through a registered yoga training course and have done quite a few other just holistic wellness and continuing education courses, mostly focused on the nervous system. I actually worked as an occupational therapist in acute care, which is trauma care, in the neurological, cardiovascular, and medical ICUs for quite some time. And through that, learned a lot about nervous system regulation, how that impacts healing, and also had some personal experience due to a traumatic boating accident when I was 17, where really shifted my perspective on things afterwards because of the chronic pain that came from that boating accident. And that is actually what triggered me into going into occupational therapy, because I worked with a really special and gifted occupational therapist during my healing, and really have kind of taken from there. And I've worked with a large community online through chronic pain, hypermobility, some muscle activation syndrome, and just co-occurring disorders related. Really, everything is related to chronic pain and inflammation. So I'm excited to be here today to share a little bit more about my training and understanding of chronic pain and Dr. Spiegel's work as well. So thank you all for having me.
Thank you. I'm very glad you're with us, Kasey. And you are a beautiful example of making lemonade out of lemons. You took your experience and restructured it in a way that helps you and helps many others. I'm Dr. David Spiegel. I'm a professor of psychiatry and behavioral sciences at Stanford University School of Medicine. I run our Center for Integrative Medicine and a Center on Stress and Health. And we study how to use hypnosis, a state of highly focused attention, to help people restructure their experience and learn to control problems like pain. And the remarkable thing is that we can use our brains in ways we hadn't expected to have remarkable effects on problems like pain, stress, and anxiety. So I hope to explain that to you here. We've done many clinical trials showing that hypnosis can significantly reduce pain under both acute and chronic conditions. And we understand a good deal now about what it does in the brain, and I'll be glad to share some of that with you. So glad to have you here.
Thanks, David. Thanks, Kasey. So why don't we jump into it? Kasey, do you want to kick us off by just explaining to everybody what happens when the nervous system is dysregulated?
Of course. Yeah, so I look at and work with the nervous system from the lens of the polyvagal theory. And so there's a lot of different ways to look at the nervous system and understand how things are working. But the nervous system itself is extraordinarily complex. And for the average person experiencing chronic pain, the nervous system is already on high alert, right? So learning something so complex can be very challenging at that time when really we're just scanning for threats. So I love to break it down into the most simplistic terms so that you can start to work with what you have. So I look at the nervous system basically in 2 categories when we're dealing with chronic pain. And so the first category is going to be sympathetic activation, which is the formal term sympathetic activation, but the friendly term is the fight-flight response. So the response when you're ready to flee or fight a threat. When you're in that sympathetic activation phase, you're constantly scanning for threat. Typically, you have muscular activation to either fight or flee. We notice that hip flexors become active. I talk a lot about the iliopsoas muscle or the psoas muscle being active in sympathetic activation. Your body tenses, your breath becomes shallow, your heart rate can increase, and your pain sensitivity can also increase in sympathetic activation. So if this occurs over a significant period of time, we see increased inflammation, disruption of sleep, and challenges with digestion and healing. Then there's the other side of the coin, which could be called shutdown or freeze. This is called dorsal vagal shutdown in the polyvagal theory. And this is also common with chronic pain. So we see more here heavy, dull, and aching pain over a very long period of time. In this shutdown phase, we also see things like numbness, tingling, and maybe a little bit of dissociation from the body. So we can also see that the body's feeling like weighed down, hard to move, very fatigued, and then we can see some emotional intensity here. Then what we also see with chronic pain and a challenging state is what we call a mixed state. So it's a combination of the sympathetic activation or the fight flight with the dorsal vagal shutdown, so freeze. And so this is a very challenging situation to be in when you're constantly scanning for threat, but your nervous system is kind of in a shutdown where you're not able to take action. So those are really how the simplistic ways of breaking down the nervous system in the context of chronic pain that I use with most of my clients. So I can bring this back to a personal experience. I know I spoke with you all briefly about the boating accident that occurred when I was a teenager. And really what happened was the initial injury occurred and I did have damage to structures in my body. After I had gone through intensive rehabilitation, physical therapy, occupational therapy, and different other types of medical interventions, technically my physical body was healed. My pelvis was in the proper position again. And like if you would think about it, you should be out of pain. You're all better. This is 5 years down the road. You're healed, but I still remain to this day in chronic pain sometimes, but it's been a long road of recovery. And so what happened was my nervous system became sensitized to that pain and reactive and protective. So it's protecting these structures that were actually okay. And so what we call that is the brain's continuing to perceive this threat, but there's no more threat. And that's just the pain central sensitization. The pain system is overactive and is better at producing pain. So that created this negative feedback loop of pain, stress, tension, and more pain, even though the threat was gone. The damage was gone. So that is kind of how I became stuck in the chronic pain loop and how many people can kind of get stuck in that chronic pain loop. So really kind of gave me the framework of, okay, my nervous system was alerted, but it stayed on that high alert for a very long time, longer than the issue was present. So how do I work with people who are in chronic pain? What is the occupational therapy framework for chronic pain? Really what we're looking at for the nervous system is to help bring that nervous system out of activation, whether it's sympathetic activation, dorsal vagal shutdown, or a mixed state. Really what we're trying to retrain the body is that it's safe. And so if you follow any of my work on social media, the majority of the information I provide is about the body being safe again and finding safe movement in the body. So what we do is we bring our mental presence back into our body, and with very slow and graded movements, we begin to feel sensations in our body without going down the pain loop. So we do things like pacing, gentle rhythmic movement, as well as sensory strategies. So the combination of all those things can start to help break down that pain loop that we typically see with chronic pain that's leading to nervous system dysregulation.
So what I do in a way is sort of start from the other end, from this organ that sits on top of our bodies. The strain and pain lies mainly in the brain. And to perceive and experience pain, your brain has to process the signals and interpret them and tell you what's going on in your body. Kasey's absolutely right that particularly with an acute injury, all systems are focused on taking stock of what's happened and doing what you can to protect the body and help it heal. The problem is that often the brain reacts to reminders of a traumatic situation physically the way we do mentally. Mentally, when you relive or have a flashback to a traumatic incident like the one that Kasey went through, it feels as though it's happening all over again. And the brain is primed to be sure that you're not once again having a serious injury to your body. And it turns out that when we remember pain or perceive a pain that's related to something that happened before, there's a tendency to go into the same fight or flight mode, the sympathetic arousal that Kasey talked about. And sometimes, if you're still in danger, that's what you need to do, but often you don't. And the brain has a remarkable ability to modulate perception. And to just give you a simple non-hypnotic example, it looks like most of you are sitting in a chair somewhere watching us. You have sensations in the parts of your body that are touching the chair. But I'm hoping that you weren't even aware of those sensations until I brought them to your attention. So the brain is processing hundreds of inputs and deciding what to pay attention to and what to ignore. Now, pain tends to grab your attention, but it needn't do that. And so you can learn to train your brain to treat signals differently. And hypnosis is a state of highly focused attention. It's like, have you ever gotten so caught up in a good movie that you forget you're watching a movie and enter the imagined world? It's focused attention. You pay attention to one thing and put other things outside of conscious awareness. This means you dissociate them. So they're there. You could be aware of them, but you're not at the time. And hypnosis helps you to narrow the focus of attention and dissociate or put outside of awareness things that normally you'd be aware of. It also helps you to suppress your usual expectations about who you are and what you need to do. And so it allows you to try out being different and see what it feels like. It's a naturally occurring state. And I think of it for many people as being an app on your phone that you haven't yet learned to use. It's there. It's an ability that many of us have. Not everyone is very hypnotizable, but a lot of people are. And you can learn to use it to deal with the emotions that come with stressful situations and to literally change your experience of pain. So hypnosis is a state that you can enter very quickly. We're long past the days of dangling watches and things like that. You can simply shift your attention, and we'll show you an example in a few minutes with Kasey about how it works. But you just shift gears and you change what you're focusing on in relation to your pain. And in our app Reverie, we have 4 different programs that we use to help people restructure their experience of pain. And the first one is to use your recollection of actual physical remedies for your pain to set your brain into that same state that it's in if you're in the warm bath or you've got the ice pack on the part of your body that hurts. Just imagine that you're doing that. So you sit down or lie down, go into the state of self-hypnosis, and just imagine yourself floating in a warm bath or whatever it is that gives you physical relief from the pain. And what you're doing is getting your brain back into the state that it's in when you are in the warm bath and when you can learn to transform the pain sensations, to filter the hurt out of the pain. So just using your experience of the things that soothe the part of your body that hurts can actually help you do it even if you're not in the warm bath. The second approach is to try and manage the pain, manipulate it, to move it from one place to another. There are people who suffer with phantom limb pain when they've actually had the misfortune of losing a limb. And, when the limb is either, traumatically removed or surgically removed, you still got the nerve endings from the brain to that part of the body. And so oddly enough, people with phantom limb often have pain in the limb they no longer have. And one of the hypnotic tricks that works is you have them imagine in hypnosis that they're using the limb, that they're moving the fingers or doing whatever they're doing. And oddly enough, having that sense of being able to control a limb they no longer have actually reduces pain. So trying to manipulate, manage the pain, change it, move it, can also be a way of giving yourself relief, of putting the pain into perspective. The third is a dissociative technique. Imagine you're on a desert island somewhere, enjoying the sun on the beach or floating in a mountain lake. Just leave your body here and go somewhere else. And it seems kind of strange, but hypnotizable people can do that. And it's just like an intense form of imagination. And you just say, body, take care of yourself. I'm going somewhere else. And the message that you're conveying is also, this is not a fight or flight situation. Whatever happened has happened. As Kasey has described, that her body had healed, but she still, as we do with the psychological memories of trauma, there are physical memories of it. And she was still having the physical memories that she could learn to soothe. The fourth, and it's more akin to what's done in meditation, is have some compassion for your body. We often get very frustrated with a body that continues to hurt and limit what we think we can do. And we do it in a way that is different from the way we would treat some other creature that was dependent on us. I just had a patient the other day who takes care of animals. She has 2 horses and 4 cats and 8 goats, and she loves looking after them. And she herself has chronic pain. And I said, do you treat your body with the same kindness and compassion you treat your animals? She said, no, I would never get frustrated with them. I said, well, your body is as dependent on you as your animals are, or as our children would be. And yet it's our instinct when a child is hurt and crying and making a fuss. What do? We soothe them. We calm them. We're not angry with them. And getting angry at your body is just another way of intensifying the pain and frustration that goes with it. So cultivating a sense of compassion for your body is another hypnotic technique that we use to help people. And we're finding that on Reverie, 4 out of 5 people get immediate relief from pain using it. They can reduce the pain by 20% in just a few minutes. And you can try it for yourself and see what it's like, see how well it works for you. But it's a matter of changing your perception of the pain, your emotional reaction to the pain. And you can do it very quickly and see how it works. And it's a hell of a lot faster and safer than opioids. So there's a place for them too, but we tend to overuse them, use them for much too long. Every day after 3 days, you're on opioids, you're more likely to get addicted to them. And so it's good to start from the beginning, training your brain to help you manage the pain. Cyclic sighing is a breathwork technique that we've been studying. And, when you want to calm somebody down, usually the first thing you say is, take a deep breath. Well, it should be done in reverse. It's the wrong thing to say, because when we inhale deeply, we do it by reducing pressure in the chest, and it allows air to flow in from the outside. And that also reduces return of blood to the heart. Arteries have muscles in the walls, but veins don't. So the pressure in the chest will actually affect the flow of blood back into the heart so it can pump. And the heart is wired so that if the flow decreases, it pumps harder and faster. So you get a sympathetic arousal, a bit like the fight or flight thing, but in seconds, not in minutes or hours. When you exhale, you're increasing pressure in the chest, you're increasing blood return to the heart, and the heart will say, oh, there's plenty of blood coming. It will slow down. There's a node called the sinoatrial node that controls it. And so it's actually better from a relaxation point of view to do a quick inhale and a nice, long, slow exhale. And you can try it now if you want to see what it feels like. Just inhale through your nose, starting with your belly, abdominal, diaphragmatic inhale. Inhale through your nose, hold. Now expand your chest completely. And then slowly exhale through your mouth, very slow. Good, Thea. It looks like you've got it there. Inhale again through your nose. Hold. Fill your chest completely. And then slow exhale through your mouth. One more time. Inhale through your nose. Hold. Slow exhale through your mouth. Now just take a moment to reflect on how you feel now. Do you notice any difference? Any of you feel a bit more relaxed just doing this? Thumbs up, thumbs down. Can you show me what it feels like? Hi, John's feeling better. Good. So is Jan. Great. So notice how quickly and easily you can help reduce your sympathetic arousal and have the kind of parasympathetic rest and digest experience just by the way you manage your breathing. So that's the kind of thing that we teach people to do as well. to help them turn off the fight or flight response and calm their body.
Dr. Spiegel, a quick question from the audience. Are there any suggestions for this for people who are triggered by breathing cues, particularly someone who is traumatized from asthma?
Asthma. Oh, yeah. Well, asthma, the first patient I ever used hypnosis with when I was in medical school was an asthmatic and status asthmaticus, unresponsive to epinephrine. And I didn't know what else to do. I was a medical student. And I just said to her, when you're having an asthma attack, there's this cycle of anxiety that just makes things worse. So the more you're struggling to breathe, the more you sense the constriction of your bronchioles, the more they tend to contract. You're getting this sympathetic tension arousal. Your muscles tighten up, so do your bronchioles. And so I just said to her, each breath you take will be a little deeper and a little easier. So focus on a nice, easy inhale and a long, slow exhale. They're afraid to do a slow exhale. They think, oh no, I've got to inhale. I've got to get more air in. And the more you struggle with that, the worse it gets. So you just say, help your body, imagine your body floating somewhere safe and comfortable. Long, brief, quick inhale through your nose and a long, slow exhale. Each breath a little deeper and a little easier. And within 5 minutes, she wasn't wheezing anymore. So what happens with asthma is there is a real problem with bronchoconstriction, but the problem is just the way you heard about pain, you tend to make it worse by struggling over it and getting this sympathetic arousal, fight or flight. So you want to get into this parasympathetic rest and digest state where you can let it happen. It does. All right, Kasey, would you mind sharing with us a little more about what sort of discomfort you have now and what you would like help with?
So right now, I currently, and I talk about this a lot on my social channels, but I struggle a lot with what is called coat hanger pain. And this is very common in the community with dysautonomia or postural orthostatic tachycardia syndrome, where there's pain from the neck down through the upper trap muscles and the upper back in the position almost like a coat hanger on the upper back. And I'm sure it's pretty common for anyone in the community or even people in general with upper back pain, a lot related to posture and things like that. So that would be a wonderful area to focus on today, I think, for myself and maybe some members of my community.
And are you feeling any of that now, Kasey?
I feel a bit of tension in my upper back area.
How would you rate that on a 0 to 10 scale right now?
And I would say it's about a 4.
About a 4. Okay. And I would ask those of you listening to us, if you want to go along with what I'm doing with Kasey yourselves and try it fine, make a note of how much tension or pain you're feeling right now. And what gives you relief from this? Is there any physical or any of the moves that you teach people to do that makes a difference?
Yes, some movements that I teach will provide some relief, especially some thoracic mobility and just helping with blood flow to the area, which is one cause of that pain.
Okay. And does something like a warm bath make a difference if you're doing that?
Yes, sometimes that's very helpful.
Okay. All right. Well, let's try that and try it together. And others of you who want to go along with it, let's see. All right. So get as comfortable as you can. On 1, please do one thing. Look up all the way up high as you can. 2 things. Slowly close your eyes and take a deep breath. 3, do 3 things. Let the breath out. Let your eyes relax, but keep them closed and let your body float. Another nice quick inhale through your nose, starting with your belly. Fill your lungs completely and then slow exhale through your mouth. Another inhale through your nose. Fill your lungs and then slow exhale through your mouth. And then let one hand or the other float up in the air like a balloon. And that'll be your signal to yourself that you're ready to concentrate. And you can let your arm rest in a comfortable upright position. You can let your elbow rest on the arm of a chair or a desk, or just floating in the air, but keep your hand up even if your elbow is down. That's good. Now, please imagine you're floating somewhere safe and comfortable like a bath, a lake, a hot tub, or just floating in space. Think of that sense of comfort that you feel when your body is floating, ideally warm and comfortable, or if you prefer something cool like floating in a mountain lake, do that. Continue to inhale through your nose and slowly exhale through your mouth. And imagine a sense of warm or cool tingling numbness, particularly in the part of your body where you feel discomfort, like the coat hanger place, your back, your neck, your upper chest. And feel yourself filtering the hurt out of the pain. Focus on a pleasant sense of warm, tingling numbness. Filter the hurt out of the pain. Now, Kasey, with your eyes closed and remaining in this state of concentration, please describe how your body is feeling right now.
My body feels lighter.
Good.
And
Where do you picture your body being right now?
I actually picture my body floating on a surfboard in the ocean, a very calm, warm day. It's a
Cool.
comforting place for me.
Good. And how would you rate the tension in your chest right now?
I would say it's about 3 out of 10.
Okay. So just enjoy the sense of floating, your body gently rocking on the surfboard. Enjoy the sun. And notice sensations in other parts of your body. How your abdomen feels, how your arms and legs feel. As you just soak up the warmth of the sun, you feel the board gently rocking. And you notice how quickly and easily you can help your body to feel more comfortable. You notice also how you can spread your attention to other parts of your body. And take a moment to reflect on how you're feeling about your body. What emotions come to mind when I ask that question, Kasey?
The first thing that came to my mind is gratitude for my body.
Sweet. That's sweet. Can you say a little more about that?
I think that I just feel like when I'm feeling lighter, when I'm feeling floating, when I feel the warmth of the sun, it pulled me out of the focus on the pain and just into the gratitude for having experiences where I can feel good or have sensations that feel good. And that just brought gratitude, and also just grateful for the ability to move my body.
That's lovely. So what you're doing is shifting the focus of your attention, both perceptually and emotionally. So you're perceiving other things that if you were just focused on the discomfort in your upper chest, you would notice. And you're changing the way you feel about your body altogether. You're focusing on what it's giving you, on the gifts that it's giving you and what you can perceive, rather than discomfort. Just feel your body gently rocking. And what else do you notice about how your body's feeling and how you're managing it?
I noticed this a bit ago, but I tend to, and this is common with hypermobility, I tend to brace my muscles, specifically my core, almost all the time. And I did notice that when I was focusing on the presence of being in the water and the sun and the board, that I noticed that my abdomen did begin to let go a bit, which is a rare and nice feeling. And also just a lightness in my hips and low back, which tend to be quite tense as well.
So you're noticing how you can correct your body's tendency to overcorrect. It is true that people with hypermobility from an injury or Ehlers-Danlos or something else, do have to protect their body from some motions, but one can overdo it and create tension and discomfort and limitation. So you're getting more in tune with your body and what it can safely do and what it can't. And enjoying most of the time when your body can do lots of things that don't involve threat or risk of injury. So just enjoy that sense of coming to a new equilibrium with your body about what it can do and what it can't. And notice how much you enjoy the sense of loosening up in your abdomen and your lower body as you get comfortable with what you know your body can do. So just keep your body floating again. Quick inhale and nice slow exhale. Is there anything else you notice right now that you want to share with us?
I just feel like a general sense of, I've been, a lot of times with pain, I feel like a lot of times I'm trying to control things in my internal and external environment to prevent or change the pain. But in this moment, I feel more of like a letting go sensation, which is calming to me rather than the controlling sensation that I often feel when there's pain present.
That's nice. So you know that concern you have for your body and that your body has about what it can do can sometimes over control, over constrain what your body can feel. And what you're learning is sort of a different map of control and sensation that your body will let you know if you're really doing something that cause harm. But you can allow yourself a freer range of motion and experience most of the time because you're knowing your body better and better, and you're knowing how to read the signals your body's giving you. And there are useful signals about trouble, and most of the time you can focus on the enjoyable ones and not have to be as constantly on the alert for threat, danger. Now, take a few moments to reflect on what this means to you in a private sense. Plan to practice this anytime you start to notice more tension or discomfort in your body. Just sit down or lie down, go into the state of self-hypnosis. Take your body somewhere where it feels comfortable and reassess your body's wisdom in telling you when you actually need to be careful and when you can just enjoy all of the other pleasant sensations your body present you with. Now we'll come out of the state of self-hypnosis by counting backwards from 3 to 1. 3, you'll get ready. 2, with your eyelids closed, roll up your eyes. 1, let your eyes open. Let your hand float back down, make a fist open, and that's the end of the exercise. 3, 2. Okay, how are you feeling?
Good. That was a very pleasant experience.
Was it? Anything
Very.
you want to share about? Did anything surprise you or anything?
Yeah, I mean, I think especially with my community or people in my community where we can be quite hesitant to things where, our pain is very real. And sometimes we can be hesitant to practices where, it's something new. We don't really know what's going to happen. But it was just nice to trust my body and then trust you as well. And just, like I said, release a little bit of control. When we're in chronic pain, there's a lot of control that we're doing. And so even just letting up that control, I did feel my upper trap. I actually did consciously feel my upper trap muscles release a bit. And, we say we carry the weight of the world on our shoulders. And so maybe if we let go of that control a bit, then we can release some of that tension.
That's great. The trapezius muscle is well named. We trap feelings in it?
Yes.
How would you rate the level of tension in your body right now?
I really do not feel tension in my body right now.
Great.
I don't feel tension in my upper back at all.
Great. Good for you. And I'm very glad to hear that. Congratulations.
Thank you.
Great. Any questions or thoughts or?
Yeah, I think it's a useful tool. I always tell my clients, patients, people in my community that it's all about building a toolbox. And so there's one day where, maybe this could work well. And maybe there's one day where it doesn't. And that doesn't mean that it doesn't have to be a tool, but maybe it could be a tool for a different time. And so I think there are never too many tools for us to access, especially when we feel a little bit constrained in our lives by things like pain or discomfort. So I'm just excited for my community to have another tool in their toolbox. And also, to just have a time to maybe change the frame of reference of what even the situation they're in. Because I know even for stress, like maybe the pain level didn't come down, but maybe we're starting to break the stress. That's one part of that loop. So if the stress level came down a little bit, but the pain didn't change, we still made progress, in my opinion.
Good. I think that's absolutely right. There are different components. And there are neuroimaging studies that show that actually the words you use in hypnosis to change your pain experience will trigger changes in different parts of the brain. So there were experiments that were done where you give shocks, little electric shocks that are not harmful but can cause discomfort. And you tell them to filter the hurt out of the pain. Imagine your arm is in ice water, cool, tingling, and numb. You reduce activity in the somatosensory cortex here in the parietal lobes in the brain, which is the primary sensory processing region of the brain. So you literally change what you feel. But if you just change the words, you give the same shocks, the same people who are hypnotizable, but you say, there'll be some discomfort there, but it just won't bother you, which is the way people sometimes feel on opioids. You get the same level of analgesia, but now it's in a part of the brain called the anterior cingulate cortex. It's part of the salience network. It's the alarm system in the brain. You hear a loud noise. It's the part of your brain that says, stop listening to him and see what's going on out there. So there are different ways the brain can modify pain experience in hypnosis, but both of them and others can be quite effective in reducing pain experience. So the strain and pain is really in the brain.
Yeah. Even the sensory experience, we talk about that a lot in occupational therapy. It's like the sensory environment. What sensations are we aware of? What sensations are we noticing? And, how can we change our perspective or change the sensations? And a lot of that was what we did as well. So it all goes so well together.
Well, I'm glad to hear that. And it's quick and you feel better and you learned a little something new about your body, which is great. Okay, Shelby, we have time for questions or comments?
Definitely. We do have time. We don't have enough time for every question. And for those who might not be aware, we received more than 100 pre-submitted questions. So we are going to prioritize those in a rapid fire fashion, and we'll let the two different practitioners here respond to each question as they see fit. So an interesting question. Can the pain system be activated by things like loneliness, PTSD, etc., emotional triggers?
Yeah, a good colleague of mine, Bessel van der Kolk, wrote a book that's been on the Times bestseller list for years called The Body Keeps the Score. And it's about PTSD, but how about how you remember it and feel it in your body? And so absolutely, memories of traumatic experiences will be remembered both in our usual verbal memory system where we think about it, see it, but also in our bodies, what it feels like. You don't just remember, you relive trauma very often. And reliving discomfort in your body will trigger memories, but the memories will also trigger discomfort in your body. And if you think about it, most, not all, but most pain medications also change the way the brain reacts to pain signals. They don't change the signals in the periphery. Some do, but many don't. And so the state of mind you're in will be both a physical and an emotional experience. So you'll remember it, but you'll feel it. And so it is possible to help people alter their literal perception of traumatic memories. Kasey, you've had to deal with that. Do you have any further thoughts about that?
Yes, I could just echo everything that you say. I would just add also, I've done a lot of work and study around fascia or connective tissue, and our connective tissue, which is basically encapsulates pretty much every organ and muscle in our body. It's a very strong web, and it keeps memories. So if there was emotional trauma in some way, or PTSD, or even if something was not physical, there is a physical sensation to emotion. And I'm sure you've all felt something like this, like a heaviness in your chest, or like you were punched in the gut, even if you were not. So just never disconnect the body and the mind. Everything is connected. And what's actually connecting everything is our connective tissue. And so there are memories stored. It doesn't have to be a physical trauma. It doesn't even have to be a trauma to cause pain. You can have pain for many different reasons. And I strongly believe, and there's scientific studies on this, but things like depression, anxiety can actually increase your pain sensation, or the feeling of pain in your body, how you're feeling pain, or that you're feeling more pain than you would maybe if you were not having those mental health, but body mind experiences.
Right. It's an interacting kind of feedback where pain can make you depressed and depression can make you feel your pain worse. So, and one just
Exactly.
amplifies the other. So what you want to do is interrupt the cycle however you can. And you notice that when you were just floating on that surfboard in the sun, if you were feeling troubled or anxious or something else, you felt better and your body felt better. And so if you can just help your body react in a way that is less damaging or difficult for you, your body will start to feel better and you will start to feel better. And often hypnosis is particularly helpful in interrupting that cycle by starting with managing your body's reaction to the situation. And then that triggers an emotional response as well that's also positive.
There's actually some languages in which the words for depression and in pain are the same.
Thank, yeah,
That's my little addition to this. Uh,
thank you,
Thank
Shel.
you. So we have a lot of questions that are similar around like people who have lived with pain for a very long time. So someone wants to know, is it possible to be 100% pain-free after living with it for decades? And another person asks, how would you work with pain when there's no physical condition and doctors can't find anything wrong? So kind of similar to what you described earlier, Kasey, you were physically healed, but you still had pain. So these are kind of two sides of the same coin.
So, so this is an interesting perspective shift that I would offer someone who is asking, is it ever possible to get out of pain? The way that I like to help someone maybe reframe that is, how about let's focus on something that could help us shift out of pain in this moment. We don't know what's going to happen tomorrow. We don't know what's going to happen in 5 days. We don't know if there could be any other things that could cause pain. But when we start to shift more into the present moment of, if I can help find something, whether it's hypnosis or a movement or breath work, I mean, it can be many different things to start to break that pain cycle. But what I would just remind that person is that if it's possible to decrease or change pain in one moment, then that does give you the hope and the idea that, yes, it would be possible to become pain-free long term. I think it puts pressure on the nervous system if you're trying to okay, is this the answer? Is this what's going to make me pain-free the rest of my life? It's one day at a time. You have to treat your body like you would with a child. It's like, we're going to just work on this in this moment and not try and fix everything down the road. I think that taking the pressure off also helps relieve pain. Yes, and remind me of the other side of the coin for that question.
When the doctors can't find anything physically wrong, how would you work with pain?
In the same way, right? It's like, your body better than anybody. Just because a doctor or provider cannot find something wrong, there's still signals happening in your body and you're aware of those signals. So you can treat that just like we did with movement, with breath, with hypnosis. And so, I mean, many years after my accident, that's what was told to me. There's nothing wrong with you. I mean, I can't tell you how many times I went to the emergency room with pain. It was almost like phantom pain from the accident. And it was like in my pelvis where the accident, where the most trauma was. And every single time I went, well, there's nothing really wrong with you. There's nothing wrong with you, but it's so discouraging when you're physically in so much pain. And I think that's what sent me down this path, right? It's like, this is why I'm doing what I'm doing now, because when someone tells me that there's no reason I'm in pain, then that really actually tends to make the pain worse. So I just remind myself there is a reason that I was in pain. I had something happen to me. My body remembers what happened to me, even if it's not currently happening to me. I need to validate the experience before I can start to shift anything. Because if I just say, well, there's nothing wrong with me, the doctors say there's nothing wrong, then what do I have to work with? It's really challenging. So I just validate my experience, work with what's in the moment, and use my toolbox.
Good for you. Yeah, we're all part of the same body, our brains and our body. And sometimes we don't know exactly what part of the body is stimulating what kind of response in the brain, but something is happening. And wherever the pain is, whatever is causing it, there's something you can do about it by modulating the way your brain processes the signals and reacts to it. And unfortunately, many people have the mistaken idea, many doctors do, that if you can fix pain with your brain, it isn't real. Well, pain is pain. You're in a state of discomfort, and there's things you can do about it. I had a patient recently who had migraines for like 12 years, and she couldn't stand it. She was a meditator. She meditated twice a day for 10 years. She said, I still have my migraines. So I had her imagine that she had a bag of ice water on her head. And because many people with migraines feel heat and there's the increase in blood flow in their scalp, and that she would cool tingling numbness. And she called me back and she said, Dr. Spiegel, my migraines are gone. Thank you. And thank you for freeing me to use my intentionality. Because in meditation, often you're just supposed to have open presence, just let things flow through you. With hypnosis, you do something about it. You do it for a purpose. And wherever the pain is, if you've got it, you've got it. And wherever it is, you can use techniques like this to help yourself and your body feel better.
Thank you both. Now, what about chronic fatigue? Is this at all related to chronic pain? Can it be related? And are any of these techniques relevant to chronic fatigue? Oh,
Well, my experience with it, it's hard. It's hard to treat. And one of the things that troubles people with chronic fatigue is sleep is not restorative for them. And they, unlike the rest of us who can be sort of activated by exercise, they feel worse. And so what I asked them to do with hypnosis is to kind of meter their physical experience, to try and help connect with their body in a way that lets them know when the activity they're engaging in is just enough to get them feeling better and activated, but not enough that they feel they're going to pay for it for the next 48 hours. So I use it to help them monitor more closely how their body is reacting to activity, when they've enough and when they can tolerate and even enjoy more. You have any thoughts about that, Kasey?
I agree. Chronic fatigue is quite complex. It's quite complex, especially in the rehabilitation with OT and PT, because, like you said, exercise can be contraindicated. What I oftentimes use with chronic fatigue is more of two things: routine. So looking at how we're planning the day and what can we use to create more of what I call glimmers of hope for getting past this chronic fatigue state that we're in. So maybe one time a day, are we noticing where we're able to do one thing more than we did yesterday? So having just a little bit of hope and perspective shift with chronic fatigue, it's a little bit different, I think, than chronic pain, but they can co-occur. The end of the day, we're still looking at the vagus nerve. Chronic fatigue, we're looking at dorsal vagal shutdown, pretty extreme dorsal vagal shutdown. Everybody needs a different treatment with chronic fatigue, but I think it is possible to find some hope and see hope each day when you're in a state of chronic fatigue with routines and glimmers.
baby steps.
Yeah.
So also somewhat related, a couple people have asked how to prevent pain during the night.
Well, Go
Yeah,
ahead.
go
Go
ahead.
ahead. You start. Go ahead, please.
I would say, from my occupational therapy background, I'm always like, what tools can you use? What can you use for positioning? For people myself with hypermobile Ehlers-Danlos, I use different positioning devices, resting hand splint, the soft cervical collar. What can you use to help prophylactically prevent that pain in the night? Are your wrists flexing and your fingers flexing and that's causing pain in the morning? So working backwards, I think, can be helpful, looking at positioning. So that's more of the, tool based, but I'm sure there's some more of the brain based that Dr. Spiegel could speak to.
Sure. And part of what happens, of course, is people with this problem get frustrated with their bodies. Damn it, can't I get 8 hours of sleep at least at night? Day is another thing. And when you wake up, you want to have tools to, change position if you need to, but get back to sleep. And going into a state of self-hypnosis, imagining your body floating somewhere safe and comfortable, bath, a lake, a hot tub, or floating in space. So you soothe your body rather than being frustrated with it. You say, the way you would soothe a child who woke up in the middle of the night and was crying. So just focus on making your body comfortable again and in building your ability using self-hypnosis to help your body do that. The one other thing I advise people is if you wake up in the middle of the night, do not look at the clock. That's an arousal cue. You think, oh my God, it's 3 a.m, or oh my God, it's 6, whatever it is. You're waking yourself up more. So instead, focus on soothing your body the way you would a crying baby.
Thank you. So, what is an easy and fast way to reset your nervous system in public? And additionally to that, what should I do if I have a pain flare in public and I'm in the middle of doing something? Quick, easy techniques.
Kasey?
Yeah, nervous system in public. So, the question really is, what kind of dysregulation have you hopped up into sympathetic activation, fight or flight? When we're in that state, something like deep pressure can be calming. So you can give yourself a pressure hug to try and bring that sympathetic activation down. When someone's in fight or flight, someone mentioned this in the comments, but sometimes it's not great to go into the deep breathing because people will focus on the inhale and not the exhale. And so I think of things more as what can we do sensory wise? You can do some pressure. So pushing down your arm can be kind of a private thing to do in public, as well as any bilateral tapping. So if you wanted to give yourself that hug and then tap right and left on your arms, that can help start to regulate the nervous system in public. The other thing is going outside. If you can go outside and hear a bird chirp, that's going to be an amazing tool for nervous system regulation in public. And any of those tools that I just mentioned could be applicable to pain in public because we know that pain and nervous system dysregulation go hand in hand.
I just say you can just do quickly a nice slow exhale. And for a moment, picture, if you can't find a bird, picture a moment in nature when you just felt good. And let your brain accommodate to your store of memories of times and places where you felt good, and you can just soothe your body that way.
Thanks to you both, and thanks for everyone for being here today, for participating. There were many other questions, and I think a lot of those questions will be answered through the free protocol that Dr. Spiegel and Kasey have kindly put together. I've shared the link. So yes, thanks to both of you for this wonderful workshop.
You're welcome, and
Thank you so
feel
much.
free to, you're welcome. Use Reverie. You've got my voice in your smartphone anytime you need it.
Thank you. Yes.
Thank you all for
Real
joining.
pleasure. Thank you, Kasey, for being with us.
Thanks for having me. It's really a nice conversation. So thanks again.
Appreciate your time, Kasey. Yes. And you guys will all be able to find where to find more from Kasey and Dr. Spiegel and the protocol. Have a great rest of the day. Great weekend.
Take care.
And
Bye-bye.
Bye.
Bye.